we are recording. Okay. All right, so I guess let's get started. How are you doing today?
I'm doing okay. How about yourself? I got free food for Veterans Day, which is great.
Yeah, I'm doing all right too. I woke up with a little bit of pain. And I mean I'm still getting better from a flare-up from last week, so but doing okay. Can't complain.
That's good.
Yeah. So I'm gonna pull out the answers if you want, or actually, never mind, we can answer this live.
Yeah, I'm down with that. That sounds great.
Okay, do you want to answer first?
Yeah, I got you.
Okay. So, first of all, how old are you? And do you have a history of autoimmune conditions besides pericarditis?
Yeah, so I'm 23 years old. I'm female. I do have hidradenitis suppurativa, which is like a skin condition. It causes boils, and it's classified as auto-inflammatory, similar to pericarditis. So I guess it's like of a similar variety.
Mm-hmm. I see. And did your doctor, did he tell you that it may be related to pericarditis?
No, so I wound up, due to hormonal imbalances, I suspect, developing this condition about 2 years ago. And I have suspected it from the start, from going on like WebMD and stuff, but it took a year of waiting for my dermatologist to finally diagnose me with that condition. And then I wound up getting pericarditis in late May of 2024 from COVID.
Oh, did you have COVID very shortly before you developed the pericarditis?
Yes, exactly. So I wound up getting COVID May 21st. I felt like I was coming down with something and under the weather, but I kept working out very strenuously. And I like ignored the fact that I was feeling like I was coming down with something. And then I woke up with full blown COVID that week. I think like I first started feeling ill on the 21st, and then like had a positive COVID test at home on May 23rd of this year.
Mm-hmm, mm-hmm. I thought it was really interesting that you mentioned that you used to work out or work out very strenuously, and you also have coworkers that do the same and wound up developing myocarditis and pericarditis. So maybe we could talk like after the questions a little bit about what you think the correlation between those two things. Because I feel like it could
Yeah.
be helpful for others too. Because I used to work out 5 days a week for 2 hours a day, which I mean,
Oh, me too.
and I ended up getting pericarditis, so maybe it's related. You mentioned that your first episode was May 2024, and what were your symptoms during the first flare-up or the first big episode?
So up until I got COVID, I was preparing for military orders, and I was in extremely good physical shape. Like I power lifted for the last 4 years. I started Brazilian Jiu-Jitsu in January of this year. I was running at least 3 times a week, at least half an hour to an hour of running, like every week, starting in December of 2023. And yeah, I got COVID. Like the first thing I noticed, it's like my VO2 max disappeared overnight. I literally could not go up a flight of stairs without my heart rate hitting levels that it would on like my fitness test for the army when I'm a mile into the 2 mile run.
Yeah, and were
Um,
you able to walk in general, or was it just when you went up the stairs and exercised?
yeah, it was bizarre. Anything like going up a mild incline at all or going upstairs or jogging, it messed me up. So I remember I was like, oh my God, I have to go out on my military orders. I have to fly out literally a week after I had COVID. But I knew something was deeply wrong. It's like going upstairs, had my heart up to 180 beats per minute, which is it was literally not how I was until I had COVID. It just switched overnight. And then I noticed I felt like dizzy after that treadmill workout, and I felt like a dull ache in my chest, but I ignored it. And then,
Mm.
yeah, 2 days later, I wound up doing sprints up flights of stairs, and my chest kept hurting more and more. I'm like, what on earth is wrong with me? I think I might have myocarditis. And one of my friends who is in the Army National Guard, she wound up getting like 3 heart attacks and 2 strokes after the Moderna vaccine from the Army. And she told me, like, there's something deeply wrong with you. Go to the ER, stop working out. I did not listen to her. I was an idiot. I went for a mile run. It was terrible. I could barely finish it. I had more chest pain. And sorry if I'm like rambling, but yeah, that's when I decided to go to the emergency room on, I think, like June 1st or June 2nd, and I did not ship out all my orders because thank the Lord I didn't. I feel like if I would have gone for the summer for like a month of strenuous exercise, I could have just dropped dead.
And how did you get diagnosed? Like when you went to the ER, what happened?
So the ER, they I said I have chest pain, so of course they triage me first because they want to make sure you're not dying of a heart attack. And then I told the nurse my history. She put in my chart she suspects pericarditis. They did an EKG. My T waves were inverted, but I did not have any PR depression or ST segment elevation, which is characteristic of pericarditis or myocardial infarction. And the ER doctor, sorry if you could hear my thing beeping, I unplugged my seatbelt, but
You're good, you're good.
yeah, ER doctor basically just said like he didn't think anything was wrong because T waves could be inverted for any reason, like such as leads being placed improperly. But thank the Lord he put in a stat referral for me to go to cardiology, and then I wound up seeing a cardiologist with like 30 plus years of experience as a professor at Yale and chief of cardiology at my city's hospital. And based on my chest pain and my inverted T waves and my EKG, he had diagnosed me with pericarditis.
Mm-hmm.
All right, can you still hear me?
Yeah, I can hear better now actually. So what was the initial treatment they put you on? So actually, how long did you wait to go to the cardiologist after that ER visit? Did you go the same week?
Yeah, it was great. It was only a few days after, not even, which was extremely, extremely helpful.
That's good. I mean, yeah, definitely. And then what treatment did she put you on?
So the doctor did not want to put me on treatment, which was weird. Like I was in the doctor's office texting my friend who was injured by the Moderna vaccine, and she's like, "You should take colchicine. It helped me a lot." And I asked the doctor, I'm like, "Do I need colchicine?" He's like, "No, just rest. Don't do anything at all. No exercise. It will go away." And I just like something felt off about that. I don't know why he would tell me that. Maybe he thought the case was really mild because I didn't have the characteristic EKG changes of this disease. I just had the T wave issue, but I wasn't really getting better, you know? Like I just sat there with chest pain. Like if I would lay down, if I would breathe in, if I would walk around and talk, if I would exert, I would have like a lot of pain. It was really weird. It would be like in my back, in my chest, in my collarbone, in my arm.
Did you ever have any shortness of breath at rest?
I did not, which is interesting because I do know a lot of us in the group chat are experiencing that symptom, but I only really had shortness of breath maybe like a couple times after working out, and I just stopped working out completely.
Yeah. Okay, well, that's interesting. It seems like different people present with different symptoms. I wonder if it's, yeah. So how did they actually diagnose you with pericarditis because of an echo, or could it have been also myocarditis?
He did it only on the T waves because my it's weird. My ESR and my CRP have been normal the entire time I've had this disease, and my troponins were completely normal, so that ruled out myocarditis.
I see. So your inflammation marker is completely normal too?
Yeah, that's the weird
Okay.
thing. Completely normal the whole time I've had these issues, even with the most severe pain, they've been normal.
Okay. So the second doctor, did they put you on colchicine or any other treatment?
Yeah, so I wound up seeing an APRN for a follow-up right after my echocardiogram, and the echo only showed trace pericardial effusion, which, from what doctors have told me, is trivial. But she was trying to tell me, like, saying I don't have pericarditis. She was saying you probably have costochondritis, or let me refer you out. And I had to demand her, like, hey, read the echo. They still diagnosed me with pericarditis based off of it.
And then she's like, "Oh, I'm gonna go put you on colchicine." And I told her, "What about ibuprofen?" She didn't give me an ibuprofen prescription at all. She just like smiled at me and she said, "Oh, it will put a hole in your stomach. Be careful." And I'm thinking, like, what on earth is that? That's unacceptable. My mom was really mad when I told her that that's what she said. Like, they
That's
just
really
like
unprofessional, and it's really unhelpful that she would reply in that way.
exactly. So if I didn't have you guys in the support group, I would have been way worse. And we could get into that, like how had to self-medicate, unfortunately.
Yeah, I'm sorry.
Thank
And
you.
how long did so she put you on colchicine for how long initially?
I've just been on it indefinitely. They just keep sending me new refills. I've been on it since June. Um, 0.6 milligrams.
I see. So after the first 3 months, what happened? Did they change the treatment? Did they tell you anything?
Yeah, so this is where it gets dicey. So I was complaining to my cardiologist, look, this is not getting better. I mean, colchicine did improve it, but it didn't go away. And then I made the mistake of completely stopping colchicine because and completely stopping the herbal supplements I was self-medicating with because I was having really bad GI effects from
Mm,
the colchicine. But we know with this disease, you can't just come off anti-inflammatories whenever you want. You have to taper. So I first started self-medicating with like herbs and stuff. So I would take ibuprofen because I took it during COVID. I took vitamin D plus K. I took zinc. I took quercetin because it's really good antiviral properties. I took that with vitamin C. Um, I took nattokinase and serapeptase because those are good for like your heart for anti-inflammatory. I took taurine, fish oil, CoQ10. I just like threw a million stuff in my body, and then I decided to just stop taking it. My cardiologist, this is ridiculous. This man put me on prednisone, like a very aggressive taper.
oh my.
He started me on 60 milligrams of it for 3 days, and then over the following 2 weeks, I had to taper off it. And then, like, it was weird because prednisone, it gave me bradycardia, but I needed that. It kept my heart down. It made me feel amazing. And then as I started to taper, I went from feeling the best I ever did in a while to feeling a ton of pain. And it made my EKG worse.
So you had rebound symptoms.
Yeah, exactly. And
Oh,
then I follow up with him after a prednisone. He writes down on the clinical note, "I'm feeling better, but I'm feeling worse." And he's like, "Actually, the literature says that it's not good to put people on prednisone." He's like, "I'm not going to do it for you again." And I'm thinking, like, why the heck would you put me on it if you know the literature demonstrates that it's bad for people with pericarditis?
hmm. Yeah.
Yeah.
Did they ever put you on any PPIs or antacids or stomach protectors?
Uh, I'll get into that. So he prematurely cleared me to go back to activity after the prednisone disaster, which was like late July, early August. And I was feeling like decent. I was feeling worse than decent again because I was self-medicating with ibuprofen, but I didn't understand tapers at that point. So I would just take like random doses of ibuprofen every day, which is bad.
Mm-hmm.
And then yeah, physical activity made me like it made my chest hurt so bad that the cardiologist nurses were worried about me because I kept complaining about how much pain I was in the patient portal. And then they called me on the phone. I'm like, "Hey, my left arm is like going numb. I have pins and needles in my left arm. I'm in so much pain." They're just like, "Go to the ER." And I felt like I just didn't want to pay $250 for an ER copay. Like, I'm fortunate enough to have good insurance through my dad because I'm still young, but I knew I wasn't gonna die. I just didn't want to go. And
Yeah.
then that's when I had to like literally go play Dr. Google, and I had to take a trip to freaking Long Island to see an NYU cardiologist to take me seriously because I was not happy with this man back home, even if he had decades of experience.
Mm-hmm. Mm-hmm.
Yeah.
Okay. So what treatment are you currently on right now?
So I'm on my own self-supervised ibuprofen taper because this is where it gets weird. MRI came back completely normal around like September 24th. Praise the Lord, no inflammation, no scar tissue, no effusion of the pericardium.
That's
But this is
good.
where it gets weird. I've still had pain. I still would get palpitations. It did get better though. Like I noticed I would have like 2 hours on the paddleboard, just like going at it nonstop, heart around 160 to 150 beats per minute. No issue. I would kind of get mild pain in the left side of my chest after that, but I would take my meds, eat a dinner, sleep it off, and I would be fine. And that's when I went to the Cleveland Clinic. It was an appointment I waited 3 months for. I only found out about the Pericardial Disease Center thanks to people in the Reddit and our group.
Mm-hmm.
And I got a CT angiogram done. Wanted to make sure that I didn't have any like congenital defect of my heart. And that came back normal. EKG had finally come back normal for the first time in months. Like all of my T waves were normal where they should be. They weren't
God.
like, yeah, they weren't getting inverted anymore in like V4 through V6, for example. They were flattening at NYU, and then they finally became normal. And what I noticed, just as like my anecdotal pattern recognition, is that the more pain I have, the more it correlates with inverted T waves, which is weird. But I
Mm-hmm.
made the foolish mistake of having a drink because I wanted to celebrate. Like I had like 3 standard drinks in 3 hours, which is like it's what your liver can handle. But
Mm-hmm.
it made my EKG abnormal again when I saw my cardiologist back home to tell him how the Cleveland Clinic went. And I had T wave flattening. My cardiologist back home says avoid strenuous exercise, but on the other hand, the Cleveland Clinic one, even after I updated him about my scenario and the drinking, he's like, there's no contraindication for you to not work out. Just keep your heart rate below 160 for a few months until you have like no symptoms.
Mm-hmm.
And yeah, he told me a colchicine taper I could do. He gave me specific instructions, but I'm kind of scared to do that because I don't know what's wrong with me at this point. I still feel like I have symptoms and something's wrong, even if all my tests are normal, and that's like really freaking me out.
Yeah, listen to your body and trust your body. Did the doctor at the Cleveland Clinic or any of your cardiologists give you any prognosis or tell you kind of what to expect moving forward with this?
So they did not. I do have a telehealth with the NYU one because I'm curious if I need ARCALYST. I do want to get rheumatological testing done, but the one back home, the one from my hometown, he just said keep avoiding strenuous exercise until you've had at least a few weeks of zero symptoms. And then Cleveland Clinic said, as far as we're aware, there's nothing wrong with you. Your tests are all normal. You have no inflammatory markers in your blood. We're not sure if you ever had pericarditis in the first place. They said you could work out, just take it easy, like don't let your heart get above 160. He said just like walk on the treadmill at a mild incline for maybe like half an hour a couple times a week. And then as I build my heart strength again, I could increase the speed as long as my heart stays below 160, if that makes sense.
Yeah, that makes sense.
Yeah, I'll kind of like gradually increasing your cardiovascular endurance.
Mm-hmm. Mm-hmm. So for now, you're just on colchicine, ibuprofen, and very little exercise and resting. Indefinitely
Exactly.
until you feel like you can increase the exercise.
Exactly. What I started to do now,
Yeah,
I'm just keeping like a daily diary of symptoms. I haven't had a single palpitation in a day, which is really good.
good.
Before, yeah, like last week, I would have like maybe multiple palpitations throughout the workday sitting at my desk, and I do notice these things. I noticed that like my pains are becoming less frequent, even though I'm tapering off of ibuprofen now, which is an extremely good sign.
Hmm.
Yeah, so I'm
That's
just
really
looking for
good.
the zero symptoms to finally feel safe. Thank you.
Yeah, keep it up. Okay, so the next question would be, what symptoms would you look out for before you decide to go to the ER? I mean, first, how many ER visits have you had since your diagnosis? And then what symptoms would make you decide to go to the ER right now?
So I've had 2 ER visits. The first one was because primary care was not taking me seriously. They only did an X-ray, which, unless you have a severe case, you're not going to see an effusion on an X-ray. It's kind of diagnostically useless for this purpose. And he just said to me, he's like, I'm not going to refer you to cardiology. Just go to the ER. So I'm like, all right, whatever, thanks, dude. So yeah, that's why I went. That's why I went to the ER the first time.
Yeah.
I wouldn't go to the ER again. Like, I'm not a doctor. I can't tell people what to do, but this is exactly what they told me. They said, like, stiff neck, vomiting, suddenly worsening pain, blurred vision, like anything that's a symptom of a stroke, any like really bad shortness of breath. They said, like, if you just suddenly get way worse with no clear answer, they
Yeah.
said just go to the ER.
Yeah, that sounds similar to what I've heard. I've also heard low blood pressure, heart, fast heartbeat above like 180, and dizziness. Those would be symptoms of cardiac tamponade.
Yes, exactly. Especially the shortness of breath.
Yeah, and shortness of breath. Yeah, but shortness of breath, the thing is that some of us do experience it during flare-ups, and so it's hard to tell, like, when does it get bad enough? Like, what's the limit?
Exactly. It's tough. I feel you.
Yeah, yeah. And if you don't mind me asking, how did you feel? Do you remember how you felt emotionally on average before you developed pericarditis, or the months or weeks leading up to your pericarditis happening?
Yeah, so I was having like a really good time. I was having a lot of fun. Like, I was doing my army stuff for a couple weeks. So I was with my coworkers. We would work all day, and then we would go out and like go to a bar, go to dinner with each other. We would drink a lot, and I feel like the lack of sleep combined with the alcohol, combined with the eating out like fast foods and whatever at restaurants, I feel like that laid a bad foundation for me to get COVID. And like, my cardiologist told me, he's like, I don't think you did anything to trigger this, but I just have like a little feeling in the back of my mind that my intuition's telling me that maybe I caused this.
Oh, so you had a history before after like the previous COVID thing that you had of POTS. And it's interesting because similarly, like when I got COVID the second time, after that one time I was fine. It was a really bad COVID episode, but I would get dizzy after working out. Or if I worked out really strenuously, I would just get dizzy out of the blue.
Uh-huh.
Is that what you experienced?
So what I experienced, like the very first night I ever had COVID in my life was December 2021. I was just laying in bed the first night, and my heart rate was like 180 to 190 when I was laying in bed, which is like just insane. And my fever was extremely, extremely high, but I didn't go to the hospital. I just kept it down with Tylenol, and I could barely eat. Every time I would sit up in bed, my heart would skyrocket. I couldn't stand up without feeling like I was gonna collapse. So I
Yeah. So it kind of sounds like what you described of like, okay, your sleep schedule was off, you were drinking, you were kind of pushing your body physically, even though you were feeling emotionally really good.
yes.
It sounds like you were putting a little bit of pressure on your body. And it like I remember right before I got pericarditis, I was kind of pushing my body physically too, just with extreme work and not enough sleep, not a good
Exactly.
diet. And I wonder if that could have kind of like tipped the scale and caused the pericarditis.
I agree, because I think all the stuff that we would do in these situations, like drinking is bad for you. It introduces inflammation in the body. Exercising is good for you, but it causes inflammation. It releases interleukins. Um, Eating out like processed foods or like foods with a lot of butter and oil content you don't know about, it's not good for you. So I think
And
I like
lack of sleep.
yes, that all leads to dampened immune system and inflammation throughout the body. That's just my theory.
Yeah, that's really interesting. And right now in the present, do you mind sharing how you feel emotionally on average? Like, what is your most prominent emotion day to day?
I feel okay, but there's always this undercurrent of like depression and sadness where I'm scared about my health. Like my
Mm.
military career's on the line with this. I'm waiting to hear back if I could stay in or not. It's like I'm just like very sad. Like I cry sometimes because I'm just wondering, like, man, when am I gonna get better? When is this gonna be over? I'm sick of this, stuff like that.
Yeah, I'm sorry to hear that.
Yeah, thank you. I'm just like trying my best at this point. I've done everything I could. I've educated myself as much as any man could about this disease. I've seen world-class doctors. Like, I guess maybe I should just keep taking it easy and see what happens, but I also don't really have time on my side because if I stay in the military, I have to go this summer. I have to do like a lot of training that's extremely physically strenuous, and I don't know if I'm going to be able to get myself in enough physical condition to do well.
Yeah, it sounds like you're doing everything you can. So just be gentle with yourself. And I mean, your health is the number one priority if you need to take more time.
Yeah, that's the biggest issue. I've been too hard on myself, blaming myself, and it doesn't help you when you're like putting all this negative thoughts into your head. I do feel like the mind has a huge role in getting better from illnesses and such.
Do you have any mindfulness or meditation practice that you do to, I don't know, cope with the sadness or with the overthinking or the pressure?
I do not, but I try to like switch my mindset to be more positive, and it really helps that I have a big support group of like my friends and people in the Reddit and the Discord channel. It's just good to know other people going through the same thing so you feel less alone.
Yeah, I totally agree with that. Especially this rare, like it's such a rare disease and it's
Hmm.
really hard to find people. At least I haven't met anyone in person who has dealt with this or who is dealing with this, and it can be kind of isolating.
That's interesting you mentioned that because ironically enough, out of my small group of no more than 50 people, I would say in the army, between the unit I'm with now and the unit I was with, there are five of us that have cardiac issues after COVID.
Wow.
Yes.
So yeah, you mentioned that you know quite a few people who have either myocarditis or pericarditis, and I was so surprised because I'm literally every single doctor I've gone to has told me that I'm the first person they've met or that they don't see this very often.
Oh my God.
I wonder if if it's related to, I don't know, the strenuous training that you get in the army.
That's what I'm wondering too. And at least at my current cardiologist office, like my cardiologist back home said he has another female patient, but she was training and wound up doing her physical fitness testing a week after her pericarditis diagnosis, even though he told her not to work out, and it made her worse. And then Emma has told me like they are seeing a big uptick in young people needing treatment and cardiac MRIs for pericarditis and myocarditis post COVID.
Wow.
Yeah, it's scary, and I agree with what you said. I think that the physical activity could play a link. I'm not a doctor. I do know for sure that the coronavirus binds to the ACE2 receptors in your endothelial cells, which are in like organs such as your heart, your vascular tissue. So I'm not sure, my cardiologist did not know this either, but I have a weird feeling that either the COVID attacks your heart, like if the COVID spike proteins somehow get in your bloodstream, they can attack your heart and bind to those cells and cause damage and inflammation. Or if you do a lot of eccentric training, I think you could release a lot of interleukins, such as interleukin 1 alpha and beta, which we do know plays a role in recurrent pericarditis, which is why Arcalyst and anakinra work to treat it. But I'm not like a researcher. I'm not a doctor. I don't have a medical background. I'm just speculating because I'm an IT person.
Yeah. Hmm. Yeah,
But
I
yeah.
wonder if the presentation of pericarditis in different patients could have like a genetic component too. Because I know my grandmother, she had rheumatoid arthritis, and
Hmm.
for what I've heard, for some reason, people that I've met who also present similar to me, like shortness of breath or get flare-ups when they get sick, they have some kind of genetic component, like someone in their family has some autoimmune condition, or they have also some kind of autoimmune condition that could be related to it. So I don't know. I wonder, does anyone in your family have any kind of autoimmune condition or arthritis or anything of that kind?
My grandma has arthritis on my dad's side, and my mom has a thyroid issue. But yeah, it's weird. There's no one in my family that's autoimmune, really. I guess I'm the first person with an autoinflammatory disease besides the pericarditis.
Well, the pericarditis, it happens like the way the inflammation happens in the pericardium, it's very similar to the inflammation that happens in the joints with rheumatoid arthritis. So
Oh, I didn't know.
the inflammatory cycle of the arthritis is similar. They get random inflammation, random flares, and then they progressively get scarring in their joints, and that's why they have deformities in their joints too. And I
Oh.
wonder because they treat us with gout medication, which is colchicine. Colchicine is a gout medication, and
Mhm.
it's given for people with also these kind of like joint flares. So I wonder if the inflammatory process is similar to that. I don't know. Maybe it has a genetic component.
That's crazy. That does make sense because I was reading online they use colchicine too to treat familial Mediterranean fever, and I think it has a lot of the symptoms of pericarditis. I think pericarditis could be a symptom of that disease. I'm not sure, but that one is genetic.
Yeah, and you said your grandma has arthritis. My grandma from my dad's side too has arthritis.
I'm wondering if I do have genes for these conditions and they could be like epigenetically triggered because yeah, like I said, I do have an autoinflammatory skin disease and it flares whenever it wants at this point. But I do notice like stuff like smoking cigarettes triggers it.
Hmm.
Eating like processed inflammatory foods and sugars triggers it. Lack of sleep triggers it. Hormonal imbalance triggers it. That's just my personal experience.
Yeah, that's so
I
interesting.
tried to make an appointment with the rheumatologist today, and they said they don't treat pericarditis, which I don't know if I could just go in for testing without talking about my heart issue. I'm not sure how that works, but I want to explore it for sure.
Yeah, that could be a good idea. I'm sure there has to be someone that's already doing research about this. I mean, there's no way we've done Google research and are coming up with this stuff, and then there's doctors out there who are saying, I don't know anything. I mean,
Exactly.
yeah.
Hope they do more research on this condition. Like I'm really happy that they discovered Arcalyst as a treatment for this because that's extremely promising and unfortunately it's taking a while to make new developments, but at least they're figuring it out. It might just take time.
Yeah, I heard there's this new drug being developed for specifically for recurrent pericarditis.
Is it the CBD one?
Yeah, the CBD one. Let me look up the name.
I would like to do a trial for that if I can, but I'm not sure if I can because in the military you can't have like CBD, so I'm not sure if I could get that waived or not.
No, I believe where they're now in their testing, they closed they already
Oh,
have all the people needed for the trials.
oh, that makes sense.
Yeah, so it's called Cardio RX, apparently. Yeah, I'm excited about this. Hopefully it doesn't take too long.
I know I would take it if I could.
Me too. I tried getting some CBD, but apparently you need like tremendous amounts
Oh, really?
that would like, yeah, like you can't possibly take CBD as gummies or something in the necessary dose to stop or reduce pericarditis.
Oh, it would have to be like a concentrated form.
Yeah.
That
Yeah,
makes sense.
yeah. Hopefully that comes out soon.
Yeah, because I know like that famous hockey player has this. Like I have a weird feeling that as COVID mutates and progresses, we're gonna have more people getting diagnosed with this disease. I mean, I've noticed the Google search trends for like myocarditis, pericarditis, they greatly increased ever since COVID.
Yeah, and if you check out the Reddit, there's so many new people asking questions every day.
Oh, I've seen that. Yeah, I do notice that as well. It's greatly increased in numbers.
It's really sad.
Yeah, it's because this virus is so new. Like we're still learning about it. Like all the doctors I've seen, especially when I had long COVID symptoms. No one could tell me a prognosis or what to do. All they said was like wait it out. And these are doctors who are like they have decades of experience from the most prestigious schools, and unfortunately we're at a limit of our knowledge for now until more trials and studies can be done.
Yeah, and also nobody's had it long enough to know what happens 10 years from now.
Exactly.
I guess we'll find out.
Yeah, I hope I'll be fine.
Hmm. Yeah, and you mentioned your diet wasn't very good before you got the pericarditis. Is your diet better now? Did you make any changes that you feel like could help with the inflammation?
Yeah, so it's much better now, especially with doctor's guidance. So I try to eat less red meat. I try to eat more salmon, more like chicken that's grilled and not fried in any oil. I try to eat more fruits and vegetables and try to monitor my sugar intake. If I do have coffee, it's a black coffee now. I try not to just add sugars to stuff. I like to eat like Greek yogurt for breakfast. I have hemp hearts, granola. For lunch, I'm trying not to eat like the processed protein shakes because those are not good. I notice my body doesn't like them. It's not happy after eating them.
Yeah.
So I'll just eat like grilled chicken.
Good. It sounds like you're eating really clean.
Yeah, I did. I'm very happy about it. I measure every single thing I eat and I weigh it on a scale. So because of that, I was able to lose 3 pounds last month, even despite being sedentary with this heart issue.
Oh, awesome. Congratulations.
Thank you so much.
Okay, so last question would be if you could give a word of advice for people who've just been diagnosed or are new to this, what would it be?
I would say like please do not smoke, do not exercise, do not drink at all under any circumstance. Alcohol is terrible. It literally caused me to flare up even with normal tests. Um Listen to your body, listen to your intuition. Don't be afraid to seek a second opinion because unfortunately, a lot of cardiologists don't know how to treat this disease, or like you said, they don't have a lot of patients with this disease. And I would say like seek community, but don't like you could go on Google try to educate yourself about this disease, but don't like spaz out and try to self-diagnose. Like always try to listen to your doctors. I kind of didn't do that though. I kind of wound up Googling stuff and treating myself, but it did make a huge difference for me. And at least, like, my doctor endorsed what I was taking because it was what cardiologists would usually prescribe. But mine back home, I know another member of the group didn't have a really great experience with him. So I would say, though, like, don't even be afraid to travel if you want to seek medical care. Like, you're going to get the best care in these large metro areas and in big cities like Mayo Clinic, Cleveland Clinic, NYU, and such.
Oh, and
And
one last question, I guess I forgot to ask this, and it could
yeah,
help some people. Have you traveled by plane after your diagnosis? And if so, what was your experience?
so it's funny you mentioned that because I have not, just because I've seen people in the group chat who have complained about plane rides messing up their symptoms. And I like to go to the Cleveland Clinic. I drove like 12 hours, but it was worth it. I don't want to risk it going in a plane anywhere until I've had no symptoms for at least a few weeks.
Yeah,
I just want to play it safe.
I went on a 6 hour plane ride last year and it was a mistake. I got a really bad 2 week flare up
Oh my
after.
God. That's scary. That's just crazy. I don't know. I feel bad for everyone who has this disease, but at least we have a community and it helps to
Yeah.
hear other people's experiences because you'll have people say like, "Oh, don't go on Google, don't play Dr. Google," but if I wasn't Googling this disease, I wouldn't have found this Reddit. And if I wouldn't have found this Reddit, I would not have known what testing I needed to have peace of mind. I would not have known about the Cleveland Clinic. I would not have known about extremely important lifestyle changes, such as not drinking, eating specific foods that are healthier, having anti-inflammatory diets and like choices you make in your day-to-day life to just stay calm, not freak out, keep your inflammation down, get rested. I would have never known to do any of that if it wasn't for people I knew. So thank you guys.
Yeah, no, thank you. I'm also very grateful for this community. It's been of so much help, especially like when I got diagnosed, it was 2 years ago, and nobody knew anything about this disease. It was so rare, and I guess Reddit was my only source of finding other people who were going through this or had gone through it. So it was
Hmm.
really super, super helpful. And I'm so glad that they're making progress and doing more research. And there's more and more physicians and doctors that are knowledgeable about this, or at least are trying to educate themselves about it. And I think we're making a lot of progress. And hopefully, I don't know, within the next couple of years, this new medication will come out and we'll get better.
Yeah, I feel you. I might look into Arcalist if they suggest it, but I'm just gonna hang in there for now. See where it goes.
I would love to
Yeah.
have someone from the group who is on it come and talk about their experience.
That would be great. Yeah, we can make an episode like that. And I was talking with someone in the Reddit about it who's been on it for 6 months, and they said that they did have issues with rashes, but they said like the cancer risk is still relatively low. It's not like a huge problem because it's not even like a full immunosuppressant. They say it's technically an immunomodulator because it only inhibits interleukin 1. But I feel like if you would like eat clean, like do what you're doing now to keep the pericarditis at bay. I guess if you have all that stuff in your control, if you could stay away from environmental pollutants, keep eating healthy, avoid smoking, avoid alcohol, avoid processed foods, and that would be good for reducing the risk of like any bad cells mutating while you're on an immunomodulator.
Yeah, yeah. That's really good advice. Well, thank you so much for your time today. We're gonna hit an hour long, so um, is there anything else that you would like to add for the people who will be listening to this?
Yeah, thank you. I just want to say like thank you to everyone who listened to this for so long, who got to the end of this, and thanks for your interest and your time. And for anyone who's watching this right now who is dealing with pericarditis, I pray that you will get better soon. I hope that this disease will leave you, and I hope that you can live a prosperous life with minimal complications.
Yes. Oh my God, that's so sweet. Yes. Anyone who's watching this right now who is dealing with pericarditis, we also have a Discord support group, and you're so welcome to join. You can text us. There's people who've been dealing with this for 3 years or longer, and yeah, you're welcome to join. And thank you so much for listening. I hope you recover and you're healthy, you take care of yourself and advocate for yourself and trust your body and get healing.